Hello, this is my presentation about schizophrenia for Abnormal Psychology, Section 1 for the spring 2017 for Dr. Robert Evans. First, we're going to go over some of the history of schizophrenia. It was discovered or identified by Dr. Emil Kraepelin in 1887, and he believed that the illness itself, schizophrenia, had been seen throughout the history of humankind. They have found written documents that identify schizophrenia all the way back to the Pharaonic Egypt and as far back as the second millennium before Christ. A Swiss psychiatrist, Eugene Bleuler, coined the term schizophrenia in 1911. He was the first to describe the symptoms as positive and negative, which will be talked about later in this video. The word schizophrenia comes from the Greek root schizo means split and phreni means mind, to describe the fragmented thinking of the people with the disorder. Both Bueller and Kraepelin subdivided schizophrenia into categories based on their prominent symptoms and progress. The 5 types that were made by these two people, both Bueller and Kraepelin, are in the DSM-5, and these 5 types are disorganized, catatonic, paranoid, residual, and undifferentiated, and are still used today. Okay, we're going to talk about the prevalence. I have a page of statistics. With the incidence per 100,000 people, there's 15.2 people per 100,000. For males, it's 15, and for females, it's 10 in every 100,000. Their prevalence per 1,000, for males, it'd be 4.3 people in every 1,000, and females, 3 for every 1,000. The mortality ratios for all the people that have schizophrenia are 2.6 per 1,000 for the entire population. For males, 2.8, and for females, 2.5. Here I have a graph that I'm going to show. It shows the onset of schizophrenia at different ages. I don't know if you can read this. For males, it seems to be around the age of 35 and 36, and for females, around the age of 30 for like the main onset period. Next, we're going to go on to the signs and symptoms. Now, the person that I talked about earlier, his name was Eugene Bleuler. He was the first person to talk about positive and negative symptoms. Positive symptoms are good because they show that you still have functioning, but they're still not good in a sense. These symptoms may cause you to lose touch with reality. These symptoms are hallucinations, which are seeing things that are not there. Delusions, which are like abnormal thinking that somebody's out to kill you, somebody's after you. Thought disorders, like you have different ways of thinking. You think just like some of the delusions. You think that people are talking to you and they're not. And movement disorders, you may have you may stand in a certain position, you may position yourself in a certain way and stay there because you think that will help you. And then you have negative symptoms, which are associated with disruptions in normal emotions and behaviors. These negative symptoms are flat affect, which is you have no emotion on your face, all your muscles are relaxed, you don't smile, you don't look angry, you just are blank. You have reduced feelings of pleasure, which you go through life, you are just, even play times you should be happy, you're not. Difficulty beginning and sustaining activities, like maybe before the onset of your schizophrenia you like to lift weights, and now you sit at home and you don't do anything. You don't try to engage into any physical activity. Reduced speaking. They may just stop talking to people. They may only talk to certain people. Then there's cognitive symptoms, and when their schizophrenia gets more severe in some patients, they notice changes in memory and aspects of thinking. They have poor executive functioning, which is the ability to understand information and make decisions for themselves. They have trouble focusing or paying attention, and they have problems with working memory. Next, we're going to talk about the treatments. Most of the treatments are medication and psychosocial treatments. The main medication used for schizophrenia is antipsychotics. They have first generation and second generation antipsychotics. The first generation they have bad neurological side effects. Some of these, here's an example of some of these medications. Chlorpromazine, flufenazine, haloperidol, and perfenazine. There are second generation of medications they have less serious side effects, and they pose a lower risk to the body. Some of the medications are Abilify, Cefaris, Clozaril, Latuda, Invega, Seroquel, Risperdal, and Geodon. Here I'm not going to show these medication bottles up front, but these are from a family member of mine who I do live with, and they know that I have these. They take Seroquel tablets, 200 milligrams, and Seroquel tablets that are 300 milligrams. They take one of the 200 milligrams every morning and two of the 300 milligram tablets at bedtime. Just thought that would be cool, because someone in my family actually takes these. The main goal, though, while using antipsychotics, is to use the lowest amount of the medicine they can to maintain a normal life. They don't want to use too much because they can have harmful side effects if used without moderation. Yes, these medications, the antipsychotics, are thought to control the brain neurotransmitter dopamine, which excites you. I don't know the exact way that they work, but they, I guess, would lower the dopamine that you have in your brain. Okay, next we're going to talk about the controversies. And there's also psychosocial treatments, which is just learning new ways to cope with everything that you're experiencing when you have schizophrenia. There's different ways to cope with it, different methods to reduce anxiety when you're having flare-ups and major symptoms. Okay, now we're going to talk about controversies. Some of the controversies could be medication. People believe that some people who have schizophrenia take large amounts of medicine all the time, and that's not true. The doctors really push towards patients using the least amount of medicine. Like I said earlier about the side effects, they really try to keep people from abusing their medications. And another controversy could be that people who have schizophrenia are violent, and if you know someone, you should be careful around them because they could injure you, and that's just not true. If they're medicated and they're seeking help, they're usually just like normal, everyday people, and you probably wouldn't even know that they had schizophrenia. My sources that I'm used for this video would be the Mayo Clinic, www.nimb.nih.gov, academic.oup.com. I got their statistics for the prevalence among the population, and schizophrenia.com. Okay, thank you.